Welcome to Medical Arena. Today it's going to be a very important session because we are going to discuss about the obstetrical history and menstrual history, which is very important in gynae and obs for history taking, case presentation and OSP. So, obstetrical history. In obstetrical history, what are the points included? Married for how many years? Para, gravida and age of last child. So, para, what do you mean by para? It is the number of delivery after the age of viability. So for calculating para, we can say like total number of child that has delivered after the age of viability, which includes both alive and dead, plus the number of abortion or ectopic pregnancy, minus the number of dead child after 28 weeks. For example, like accident, disease, etc. Then gravida. How to calculate gravida? Gravida, it is the total number of conception irrespective of the site and duration, including the present one. So next is the age of last child. Then menstrual history. In menstrual history, we can see the age of menarche, then menstrual period by menstrual cycle whether it is regular or irregular, then last menstrual period and estimated delivery date. So let's start with a question that came in the university exam for OSP. The question is, a 35 years old woman came with history of heavy menstrual bleeding for 1 year. She is regularly menstruating woman. Bleeding continues 5 to 7 days, but the flow is excessive. Her last menstrual period was 10 days back. She is married for 12 years, has 3 living child and 2 abortions, and age of her last child is 4 years. So we have to calculate menstrual as well as obstetric history. So we will start with obstetrical history. According to this question, it is told like she is married for 12 years. So here we got the answer as 12 years. Then we have to calculate the para. How to calculate the para? It is the number of delivery after the age of viability, which means according to this, total number of child that has delivered after the age of viability, it is 3. So we will calculate para here. It is 3. And here number of abortions, it is 2. And the number of died child after 28 weeks, there is 0. So this will be the para. And gravida. Gravida, it is the number of conceptions irrespective of the duration and site, including the present one. And age of last child, it is 4 years. So we completed the obstetrical history. Now comes the menstrual history. According to this, the age of menarche is not mentioned in the question. Next is the menstrual period by menstrual cycle. Menstrual period. Here in the question, it is said that bleeding continues 5 to 7 days. So here the menstrual period, it is 5 to 7 days. And the menstrual cycle, it is also regular. As it is told, she is regularly menstruating woman. So it is regularly. Last menstrual period, it is told, it is 10 days back. Then here it is told the flow. The flow, it is excessive and heavy menstrual bleeding. So here the flow, it is excessive. So that's all for today. Thank you.